Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we're looking at what is known as the Wilms tumor. So let's understand what is a Wilms tumor. So Wilms tumor is aka the nephroblastoma or the triphasic tumor. So it is a nephroblastoma or the triphasic tumor. So here the syndrome is, it involves a WT1 gene defect. WT1 gene defect or the chromosome 11p13. And there is also involvement of VAGR, that is WAGR, and this is nothing but the Wilms tumor. There is aniridia, genital anomalies, as well as the MR, that is a mental retardation. Next is the Denys-Drash syndrome. The Denys-Drash syndrome, the gonadal dysgenesis, as well as a congenital nephrotic syndrome. And this leads to the renal failure. Next we move on to the WT2 gene. The WT2 gene is, it involves a chromosome 11p15 and the Beckwith-Wildermann syndrome is associated with this. There is enlargement of the body organs, increase in the body organs, as well as there is a hemihypertrophy, renal cyst, as well as a adrenal cytomegaly. So what is a histopath? Histopath is that the tumor, it displays a classic triphasic histology. That is with the blasternal, stromal and the epithelial features. So this blasternal, stromal as well as the epithelial features. Next, moving on, what are the clinical features of the Wilms tumor? The clinical features is that there is a huge palpable flank mass. There is a huge palpable flank mass. There is a hemihypertrophy, as well as the hematuria and the hypertension. Then looking at the diagnosis is by, there can be CT USG and it is confirmed by the excision biopsy. Now let's understand the staging of the tumor. The tumor is divided into 5 stages. Stage 1, 2, 3, 4 and 5. Stage 1 is confined to the kidney and complete excision with the renal capsule is intact and the negative resuscitation. Resection margins and the lymph nodes are negative for the Wilms tumor spread. The stage 2 is a regional extension beyond the kidney capsule but is confined to the flank. And it includes the tumor penetration through the capsule but is confined to the Gerard's fascia. And the infiltration into the renal vein and complete excision with the negative resection margins. And the lymph node is negative for the Wilms tumor spread. Stage 3 is the residual tumor but is confined to the abdomen. And this includes the regional lymph node. Then the periosteal contamination, this biopsy, this pre or intraperitoneal tumor rupture, this tumor growth through the peritoneal surface and this positive resection margins. Next, stage 4, there is a distance metastasis and it involves the lung, liver, the bone as well as the brain. Next is stage 5, involves the bilateral kidney or the diagnosis. Now, how do you treat this? The treatment is by the transabdominal nephrectomy. Transabdominal treatment is by the transabdominal nephrectomy, and it is followed by the chemotherapy. So this is followed by the chemotherapy. That is, it can include the vincristine as well as the dactinomycin. So vincristine or the dactinomycin. So it is started before the discharge by the post-op day 5 and prognosis is usually good. The Wilms tumor is highly radiosensitive. It is RS, radiosensitive, and the post-operative radiotherapy should be given within 10 days after surgery. So post-op radiation, they should be given within 10 days after the surgery. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.